Today we're speaking with Dr. TERESA BERTSCH, Vice President of Medical Affairs at the NARBHA Institute and Chief Medical Officer at the Guidance Center in Flagstaff. Welcome to 10 with Palm, a series created to dialogue for 10 minutes with community leaders and those of influence throughout Arizona. While the COVID crisis continues to impact and disrupt much of the world, one could argue that it has disproportionately strained those working in the healthcare professions. These strains on medical professionals, their families, and the entire first responder community will likely have a lasting impact on the field of medicine for years to come. My name is Dan Palm, and today is part 2 of our conversation with Dr. TERESA BERTSCH, Vice President for Medical Affairs at the NARBHA Institute and Chief Medical Officer at the Guidance Center. Dr. BERTSCH holds both an undergraduate and graduate degree from Stanford University, as well as a doctorate in medicine from Case Western Reserve School of Medicine, and is a board-certified psychiatrist. During our conversation, we discussed the global COVID crisis and the ongoing mental, intellectual, and moral strains that healthcare professionals are experiencing during this global pandemic. This brings to mind PTSD and something you said in a recent presentation about how healthcare workers are not immune to PTSD. Could you share a little more what you mean by that?
Right, yeah. If we look at prior pandemics, and the previous one that were more limited in scope, but still really important, were the 2003 SARS epidemic, and then the 2009 H1N1, the bird flu one, and then also HIV. And they found that healthcare workers that were involved in the front lines of those epidemics, at the time, 21% of them had PTSD, and the range was like 10% to 33%. But the really interesting part about that is that when they went back and they looked at those healthcare workers 3 years later, they found that 40% had high number of symptoms of PTSD. Like they had the PTSD, but they had a high number of those symptoms as well. So they were clearly suffering as a result of taking care of people back in those particular epidemics. And those were pretty isolated events. Now we have across the world this pandemic, and what is it going? If we think it's going to be 40% of the healthcare workers are going to be developing PTSD 3 years down from now, what does that mean for our healthcare system? What does that mean for this whole occupation? Does that mean that we're going to have doctors and nurses quitting? We're already starting to see some of that. That maybe people aren't going to want to choose healthcare as a profession, because maybe it's not going to seem like a noble profession. Maybe it's going to seem like something that you're sacrificing yourself for. There's lots of things that people can do that help people, that use your intelligence, that are team-based. All those things are like things that people really love about being a healthcare worker. Like, well, why choose something like this? And I think that that's going to be potentially devastating for our aging population.
What resources do you have there, or that you see are available within Arizona that folks that might be seeking out support could make use of?
Well, I think that we really want to move beyond personal resiliency. I think that a lot of the wellness focus on healthcare workers has been to eat right, get your sleep, meditate, exercise, have a hobby, all that stuff. And that really just puts a lot of the focus onto the individual, and it can almost become a moral failing. And I think we're moving away from that, which is really great. And I think that the pandemic is going to be part of that. The Arizona Medical Association is launching a peer support program for physicians and for residents. So those are physicians in training. They've already finished medical school, but now they're interns and residents. And that's going to be a free coaching program one-to-one support. They've received funding through Access, which is our state Medicaid program, and some money that has come down through the feds to really assist healthcare workers with who have been on the front lines with COVID-19 treatment. There's also a free program through the Arizona 211 line, so you just dial 211, and it's called Resilient Arizona Crisis Counseling. That's also from money that has come down from the federal government in order to provide counseling for any Arizona resident related to this. And then the Arizona Nursing Association has a well-being initiative, and so on their website they have a lot of resources. They have like a text-based support counseling. They have nursing support groups. They also have free counseling, and so those are really helpful. And then there's a national physician support line, which is run by psychiatrist volunteers, and it's available 7 days a week, 8 a.m. to 1 a.m. Eastern Standard Time. And they will also do physician support. I'm a volunteer for that physician support line. I'm also a volunteer for the Arizona Medical Association peer support services as well. And I think that these are the kinds of things that people can take advantage of right now.
Thank you, Dr. Bertschch, for speaking with us today. If you've not yet followed the 10 with Palm Facebook page, I encourage you to do so. My name is Dan Palm. Stay tuned for more exciting episodes with community leaders and those of influence throughout Arizona.